whenever you're ready.
Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and today we're going to be talking about hip pain. Now, hip pain is a common problem felt by a lot of different people. Mainly as we age, we tend to have more hip pain than when we're younger, unless there's some kind of injury involved. Now, hip pain can be caused by a couple of different things. It can actually come from the hip joint itself, but it can also be referred pain from the back or from the SI joint, which is where the spine actually comes together with the pelvis. So, just so I can give you a little bit of visual of what we're talking about. So the hip joint itself is where the femur head comes into the pelvis, so that's that joint there. The SI joint is where the sacrum attaches to the pelvis, and when this joint gets irritated or aggravated, it can actually refer pain around to the hip. We can also have problems in the lower back that can create hip problems. So really is important to get an exam by a doctor to determine where exactly the hip pain is coming from, so that you're not chasing the symptoms and actually getting to the root cause of the problem. So a couple of things that we're going to do today with Liz, my lovely assistant, is I'm going to show you a few different adjustments that we do for the hip itself, and then 3 different stretches that we do here in the office to help loosen up the hip. One is going to be the hip flexor on the front. The other is going to be the IT band, so that'll cover the side of the hip, and then the piriformis muscle will be dealing with the back of the hip. So first we'll show a couple different adjustments on how we can address some problems that may be causing some hip pain. So if we do have a problem where the femur head is restricted in the socket that it goes into, then we need to distract that femur head out, and we do an adjustment where we basically just do a distraction on the leg itself. So I'm gonna have you scoot down the table a little bit, please. There we go. And so we're gonna distract with my knees on her ankle, so it's pulling here, and then we'll just give it a few light thrusts like that, and that helps distract that femur head out of the socket, and if there is any kind of restriction, can help to break up some restrictions or maybe even some scar tissue that may be in there. So maybe flip over on your stomach. This next adjustment is going to be on her SI joint. So that's the joint where the sacrum, which is the base of the spine, comes together with the pelvis. This is a joint that needs to move when we walk. So if this gets irritated or gets restricted, it can create problems, and then those problems refer around into the hip. Okay, so for this we actually use our table to help with the adjustment, so it'll drop underneath her. That'll allow us to not have to put as much force into the body. So we'll find a couple of contacts, 3 quick adjustments there. And so that helps to level out the pelvis, get that SI joint moving a little bit more, and allow for the irritation to go away. The last adjustment would be for the low back. So again, the low back, which is your lumbar spine, you have nerves that come out of there, and those nerves run down into your leg. If it's higher up in your lumbar spine, the nerve actually runs to the hip, so it may be pain that's referred from the low back itself. So go ahead and lay on your right side. And so we'll show you how we do our low back adjustments. Your belly here. And nice and easy, not too much force that gets put in, that gets those joints opening up and takes the pressure off the nerve.